Good morning, everyone. Welcome to the Board of Clackamas County Commissioners Policy Session on May 10, 2023. Administrator Gary Schmidt, you're up.
Thank you, Chair Smith. Commissioner West is on his way, but he's not present yet. Otherwise, all commissioners are here. The first policy session today, opioid settlement funds, progress and update on community engagement efforts, and asking the board what you'd like to do, funding priorities. Presenting are Rod Cook, Director of Health, Housing and Human Services, and Philip Mason Joyner, Public Health Director.
Good morning, Commissioners. My name is Rodney Cook. I'm Director of Health, Housing and Human Services, and with me today I have Philip Mason Joyner, who is the Director for Public Health.
Welcome.
Thank you.
We're here today to give you an update on the community engagement the efforts related to the opioid settlement funds. And Philip will provide background information for you about the settlement, allowable uses for the settlement funds, as per your directive, the internal and external engagement that we went out with, the community staff did, and the work that has been accomplished since last August. After that, we would like to dialogue with you, with you about next steps related to the opioid funds. So with that, I'll hand it over to Philip to go through the slides, if that's okay.
Yes, please, Philip, go ahead.
Thank you, Chair. Thank you, Rodney. Good morning, Chair Smith and Commissioners. Tony, if you can put up the slide deck.
I did not receive a slide deck. I just have the PDF materials.
If you open up the PDF, you should be able to make it full screen and show the specific slides. And I'll let you know when to go to the next one.
While Tony is doing that, I'm just going to start with a question. I noticed on the document that 9 of the cities in Clackamas County participated in the opioid settlement. Was that right?
Correct.
And that's not all the cities in Clackamas County. Is there a reason for that?
It was based on population size. And cities opting to choose, if they met those population size thresholds, and then they chose to participate in the settlement. So those were the 9 out of the 16 cities in Clackamas County.
Right.
We have done some outreach to additional cities who have not received funding directly, because while they may not receive funds directly to their city, municipality, it's very important that they be at the table and give input and be involved in this process. 2 of the largest ones are Estacada and Malala that were not included, and we have proactively reached out to those 2 cities to be involved.
Good. Yeah, I just noticed that. I said, wonder why they aren't here. Thank you very much. Good. And so we need them at the table too, if I assume they want to participate.
So they're stakeholders and they have standing really in this lawsuit then, right? Or the settlement.
We've tried to create an inclusive process where they're invited to be at the table. Absolutely. Do they have legal standing? I would look to county council. I don't necessarily believe that they would necessarily.
Okay. But
They'd be part of the county's umbrella.
but they still feel they have some ownership in the settlement dollars.
Absolutely, and I think the community needs and the opioid crisis is impacting their community, so their voices should be included and heard and needs addressed as part of this process.
Okay, great. It's too bad Commissioner West isn't here. I think it's an important point to make when he gets here.
Right. How you doing, Tony?
Should be live, man.
Okay, very good. So the second slide is the agenda or the objectives of what we hope to cover. I'm going to briefly, in about 10 minutes, because we have a half hour today, provide a brief overview, refresher for some of you on the background of the opioid settlement and how the funding works, share a summary of the outreach and community engagement that has happened to date. Back in August of 2022, last year, the board directed us to do some outreach, so I'll share a high-level overview of those findings, and then we're hoping that I can hand it to the chair and have a board discussion to hear what your priorities are for the funding and what you'd like to see, so that we can move forward with next steps and have this important work move forward. So slide 3, background on the settlement agreement. Oregon will be receiving approximately $333 million as part of the Johnson & Johnson and the distributor settlements. The state will retain 45% of those funds. 55% of those funds are distributed to cities and counties. So on the right-hand side there, you can see those 9 cities in Clackamas County who are receiving funding directly. Clackamas County will receive $13.7 million. Cities receive a lesser amount. That's based on their population size and a variety of public health metrics as outlined in the settlement agreement. And then there's still some pending settlements from Purdue Pharma, from CVS, and from Walgreens. So those have been settled in the billions of dollars, but we don't know yet. That's national, so we don't know how much of that money is coming to Oregon, how much of that money will come to Clackamas County. So these numbers will be a little bit larger than what's reflected here. We just don't know the exact amounts yet. The defendants, they have 18 years to complete payments, so at this point, a little over 17 years that this $13.7 million could be provided. We have heard that it will be front-loaded in the first 2 to 3 years, but with this settlement, it's not your typical grant where we predictably know how much money is coming in. At this point, in Clackamas County's fund, a dedicated fund sitting untouched, is $2.9 million is what we've received in funding to date out of that $13.7 million. So that's how much is in the county's bank account, $2.9 million. Next slide, please. When Clackamas County signed on to participate in the settlement, all jurisdictions across the nation agreed that funds would be used towards these 9 strategies. I will not list them all, but they're reflected here. Many of these strategies are already carried out in Clackamas County. This provides an opportunity to enhance existing efforts to build capacity and to increase coordination of the work that's needed in order to address this crisis. In August of last year, we discussed capital construction and improvement projects. I know Commissioner Savas had a lot of questions about that. At that time, DOJ and OHA said it wasn't allowable. We've been seeing, though, that a handful of states across the country are investing in capital construction, so we've been asking more questions. We believe that while the agreement is really silent on the issue, that capital construction projects could still be on the table. I think the key is that you've got to be able to connect anything that's funded to these 9 elements listed here. Next slide, please. Data is really critical and, of course, super important to help inform the situation and what the community needs are. To look at that, I'm not going to share any data today. I've shared it in the past. Public health does have a large amount of data sets at the population level that we can break down by local cities or towns. We've used a lot of data to share with the community to help guide these conversations through our engagement. In general, just for the public watching, most of the data is from 2019 to 2022. Most of the data is trending worse. The crisis is getting worse. It is not getting better, is what we see in general. Perhaps the only exception would be healthcare providers are prescribing less prescription opioids, so that's a good thing. But in general, the metrics are all concerning. The crisis is here. It's, as I said, it's not getting better. Next slide, the timeline. This is a busy slide. You do not need to read all the details here, but I do think it is a nice, just one visual to summarize the overall process of what the framework is that we are implementing, that the board gave us direction to move forward with back in August. This is based on the national framework that was developed by Johns Hopkins. It shows that assessment and evaluation is ongoing throughout the entire process. Community engagement, which we are wrapping up now. And then the next step, if the board chooses to continue to move forward with this, would be a multidisciplinary group of steering committee members to blend this community feedback I'm about to share with the board priorities for your funding, to put together funding proposals and an implementation plan to get into details on how to implement and get the funds out the door, if that's a direction or not the board wants to move forward with. So now getting to the outcomes and the highlights of the community engagement efforts. While H3S is up here this morning presenting, I am really appreciative and proud of the internal coordination of the county departments that have been involved in this process. our sheriff's office, juvenile department, community corrections, and the DA's office. I know Captain E.B. from the jail is here. He's the chair of the state's opioid settlement board. Really appreciate the collaborative work and teamwork that's been happening. Really exciting to see the potential of how we could do much more to coordinate the work around substance use together as one team. Our staff did wonderful presentations to city councils, the ones reflected here. The highlights have been, no surprise, need more services. There's a lot of demand in the community. I think none of you are surprised to hear that whatsoever. A positive good news is that some of the local cities have expressed interest in providing their funds directly to the county, recognizing that some of them are receiving a small dollar amount. And this, there's opportunity where the funds could be spent at the county to make a larger collective impact. And so that's a possibility as we move forward. And then in terms of engagement with the community, staff engaged over 60 service provider organizations, held listening sessions, focus groups, and surveys, really highlighting the need to engage and hear from folks that have lived experience with substance abuse, either personally or within their families. Also, a lot of discussion around how getting to the root cause of the issues around the social determinants of health, that the conditions in the community and focusing on those issues are really going to be what makes the lasting impact to help support people, help support our residents being healthy and safe moving forward. Just a couple more slides. There's lots of analysis and information we have and trying to distill it in just a couple slides, but this slide does a nice job of summarizing the gaps that community members and especially these local organizations identified for us that I think resonate with the board quite well. Limited rural and culturally responsive services, the workforce shortages and challenges, of course, and to need to focus on our youth, that by focusing on prevention, we can really work to stop this crisis from happening for future generations to come. And then my final slide for you is a summary of community priorities, so some feedback from the community about this big topic and where you could consider looking at, which I hope is helpful, broken down by those 4 different categories. I'll just hit on a couple. For recovery, more peers, folks with lived experience to be part of the solution, as I said earlier, that can help to augment some of the workforce challenges. Under prevention, to, as I said, focus on youth, to expand school-based interventions, so providing current curriculum for educators so that they can be teaching our youth about new and emerging dangers. Mentorship programs, parenting classes, academic supports, after schools, there's just so much need there. Under harm reduction, to increase the distribution of Narcan, which is a life-saving nasal spray medication that can reverse the effects of opioid overdose, so getting more of that into the hands of the community. There's a lot of demand. Having more mobile services to get out into the rural areas, which we've done a little bit of work. The pandemic provided an opportunity during COVID to do some mobile work, but we could expand that to other areas. And then treatment, which I know is a big board focus, and I think aligns with a lot of what the board's been talking about in your planning meetings recently, increasing residential treatment, expanding warm handoff programs like our Project Hope program, which is our county's community paramedic program, and supporting crisis stabilization centers, which I know the board is already moving forward with behavioral health and our community corrections team. So that is very affirming to see that the community is in alignment there with some of the things the board is already doing. Okay, with that, I'll take a breath and hand it to you, Chair. Happy to answer any questions or however you'd like to approach engaging the commissioners in discussion about what they would like to see the priorities are, how to move forward with getting the funding moving forward and next steps.
Thank you, Philip and Rod, for this presentation. It's quite informative. I have a couple of quick questions. I know every commissioner will want to opine on this, and that's why we're here today. The $2.9 million, which we have received, correct?
Correct. It is in the account.
Is there a deadline of time that we have to spend that? Is there anything in the settlement agreement, maybe that's for county council, that money needs to go out the door in a certain amount of time?
I haven't seen, I'll have to research that with county council. I've seen the deadline for when the defendants have to provide us with the funding. I haven't seen, I'll need help with county council to research if we have expectations around when we have to spend the money.
Okay.
I,
County council, you don't know?
I don't have an answer. I can
That's
look into it.
okay, just research it and get back. I put you on the spot, I know that. I just, because that may be critical in our decision making. I don't think there's a timeline on it, but I don't know for sure.
Rodney just reminded me that there is annual reporting requirements where we have to share with DOJ and OHA. There's some reporting that we have to submit to the state in terms of what's being spent, the implementation of the funding. So we do have that requirement.
Sure.
But I don't think that necessarily means we have to.
Okay. So you know this board has had discussions in our planning committee meeting about establishing a blue ribbon committee to work on the recovery model. And, using different experts from this and developing a plan on what recovery looks like in Clackamas County. Although we have not been very specific on what that is going to be because we're waiting to gather more information from outside sources as well as our trusted sources in the county to develop a program and go forth. I assume that some of this opioid money can be spent on that effort, knowing the entire effort has not been identified. And Gary, when is our next meeting on that?
We're going to come to you at issues, I hope, in the next 2 or 3 weeks to finalize the structure of the Blue Ribbon Panel.
Okay, all right. So that's that issue. There's a lot of good information in this, and I appreciate it. I'm happy to see that some of the cities may want to join us with and aiding their money. Now, with that in mind, I would assume that they would want some of these recovery models in their locale as close as we could get to them. And so my outreach to them would be the cities, whom I don't know who they are. Do you have an idea, if you put your monies with us, do you have an idea what that would look like for you in your area?
I think in terms of cities providing funding to the county, I think there's a lot of conversation that would need to happen. There would have to be intergovernmental agreements. We would really have to scope it out so that way we're clear on expectations. I would, at this point, it sounds kind of high level and broad. I think though once you sit down and really work through the issues, there's a lot of details that likely need to be figured out because we would want to position this where everybody's happy and feels good about whatever model
Right.
needs to be developed. But it all
And
needs
I
to be
do
figured out.
understand their willingness because it would quite be programmatic for them to initiate a program that maybe they don't have. I mean, if I was a city like that and I knew the county was interested in doing that, oh, by all means, I would want to partner. I'm hoping they're thinking along those lines. We have a lot of comment. Commissioner Savas, you're up.
Yeah, well, thank you. I want to hear from my colleagues before I actually opine on any of these, but I do want to say a couple things I'm concerned about. I'm going to use this analogy that's probably not the best, but I remember a friend of mine many years ago got an inheritance, and he was a young guy, and his sister and I were making sure he saved some money and made it well spent. And sometimes when one-time money like this comes available, I think a lot of us we typically want to see some lasting, be able to look back and say, here's what we did, right? So, ideally, we can do something well. But I also know that if we spread this out so thin and dilute it so thin, that there's probably may not really have any effect or substantial impacts. So metrics come to mind, and I mentioned this yesterday. I'm going to be mentioning this through the budget season. We haven't really got our strategic plan that got reworded or restructured into managing for results and so forth, but we can't make decisions really based on good data. What really works? How do we inform ourselves on what works when we spend these dollars? So I feel a little bit handicapped there, but I did want to put that out. I appreciate being updated on the capital. That's something that could have a lasting impact, or a look back on. But and before Commissioner West came into the room, with Commissioner West, there was some discussion about the cities that were part of this joint lawsuit have some, rights, ownership, so to speak, of the dollars. So we need to be mindful of their input. But I do appreciate really the opportunity to actually be here today, having these questions and ideas. And, we need to start somewhere. This is the starting point. And hearing from us, I think, is a help with that guidance. But I think the lack of metrics or maybe, doesn't help us today necessarily, but it could. That makes sure we spend these dollars towards a program, again, having, being that are truly effective and have a lasting impact would be great. I'll just stop there. I made my points and just want to, before I opine on where or how, like to hear from my colleagues.
Yeah, I have some things I want to say too, but I'd like to hear from all the commissioners. Commissioner Schrader, you're up.
Yeah, I wanted to mention a few things here. Actually, to your point, Paul, there's been a lot of work done at the national level on this. And, when people say, well, what do you bring home from NACO? Largely what you bring home is case studies. And I'm going to mention a few right now that are pathways. So again, you do the groundwork to see where there is in your own particular county, but there's some really good information. Basically, actually, for example, Deschutes County has been featured as a case study for a crisis stabilization center. And that is a document, NACO Behavioral Health Continuum of Care. There's a link on NACO County funding opportunities to support community members experiencing a behavioral health crisis. And there are four examples using opioid litigation settlement funding towards planning and treatment centers. There's been a lot, as I look through the literature on planning and treatment centers. And again, I have all the documents here with me, folks, that I keep bringing back. But Philip, I was hopeful that we could get together and I could go through some of these links with you as we move forward. There seems to be a lot of emphasis here on treatment centers and triage centers, at least from the national level. So I think that feeds into, Ben, what you have been saying about this. So there's plenty of roadmaps out there how to get there. The other thing I'd like to mention, that one of the reasons I've keep talking about Gina Nickel on our Blue Ribbon Committee, she is appointed to the NACO Commission on Mental Health and Well-Being, and she's one of 15 members of that coalition that actually looks at that. So from these examples and from some of the past NACO, observations that I've met and gone to on this issue, I was going to put forward names for the Blue Ribbon Committee of folks that have already presented there who are also experts across the nation. But I wanted to make sure you guys know I have all of this. I'll make sure I get it shared with the people that really know what they're doing, okay, because you're the experts. And I'll make sure that all these links get to you, colleagues.
Great.
Okay? All right.
Thank you. Commissioner Scholl.
Yes, good morning, Philip. Good morning, Rod. Okay, I'm looking at the 18-year payout. I'm looking at Exhibit E, the recommended uses, or actually the allowed uses for the money. Have you looked at that over that 18 years, a phased priorities? In other words, taking these Exhibit E and phasing our efforts over those 18 years? Or are you looking for some ideas for just StartX, if you will, use of the money? And the other question I have is on the recommended uses in Exhibit E, has the healthcare staff weighed in and given us any recommendations on those? Yeah.
The collaboration that exists that we talked about, the sheriff and the juvenile and DA, that collaboration, these are people who do the services now as it relates to opioid victims or opioid users. And so when you ask the question of, is there a phased approach, there's a I'm going to call it a street systems approach, if I could just break it down to that. And then there's a treatment. And so you have to have things, you have to have treatment, but you have something on the front end for community and something on the back end. So when somebody before they go to treatment, they're in treatment, and then when they come out of treatment, you're going to need supports all along that continuum. So I'm going to answer your question this way. You need it all to be effective. And so there's a long list of possibilities that you can use the funds for. In that appendix that you mentioned, we don't have the money to do all those things, but you do have a group of people who think they have all those pieces of the system that they would like to put in play.
Okay, so, yeah, what was on my mind was, it's hard to have everything a top priority.
Yes.
You see what I mean? So anyway, you don't need a decision today from the board.
No.
This is just informational. But sometime in the near future, maybe we can look at what is actually a priority now.
Now, yes.
What's going to be a priority in 2 years and 6 and 8 years.
Yes, agreed. That's good.
Thanks.
Thank you. Commissioner West.
Thank you, Chair. Good morning, everybody. A couple things resonate with me this morning as we look at this. I really appreciate Commissioner Savas's approach to making sure that when we do have this money, that it's impactful and not overly diluted based on how much it is. I think that's an essential that we try to get the most bang for our buck with the resource that we have. A couple things and I've reviewed this, and great presentation, Philip, really good job. And thank you for the documentation ahead of time. There's a lot to pick through here. Thank you for that. And one of the things that just comes to my mind, and maybe Mary, you might be able to help me with this, is we've talked about the stabilization center. And I wanted to know what your thoughts were. Thank you for coming up. Your thoughts were around potentially using some of these resources, even for the respite piece, that more sheltering piece that we talked about. There was initially the 23 hours, then potentially attached within that building as that more, maybe a couple days stay, right? And I didn't know. I was curious how you thought this intersected with this funding and what you guys were doing, which is so important.
Yeah, thank you. So Mary Rumbaugh, Clackamas County Behavioral Health Division Director. I think, we are not quite there on the programming for respite, so I think you actually identify a good opportunity around what will respite up to probably 30 days look like, and with, the types of supports and services. What we know is that we will be seeing folks in the 23-hour crisis stabilization who are impacted by substance use, including opioids. So we're gonna have to address the support services there, including, are they, once we get to phase 2 and develop out the respite, but more importantly in phase 1, how we actually then connect them to the community resources. And so I think that, at least for phase 1, my bias is a little bit around, to Commissioner Savas's point, we really need to be making sure we're investing in those potentially existing programs that we know are getting really good outcomes, because we don't want to stabilize individuals in the 23-hour crisis stabilization and then send them out without any supports.
So that's some of the more impactful right now piece. I'm really impressed with that. Are you guys, can you review with us just really quickly the what those funding sources looked like to get this important asset off the ground? Your guys, is this 23?
For the 23-hour?
Yeah. And then even maybe a little into the future, I know we're not there yet for the 30-day stay piece.
So if we're talking about sort of the resources to lift up the program, right now, the partnership for ongoing funding, or really ongoing program services, is that partnership with Care Oregon and their funding into sort of community investments. So again, the 23-hour stabilization center is going to be really about truly just stabilizing individuals with peers, master level clinician, a case manager. Again, I think the connection point post that 23 hours becomes really the critical piece, so that we don't see folks retouching law enforcement or mobile and coming back to the 23-hour, crisis stabilization center.
That's the gap then,
Yeah.
that touch point.
Exactly.
I think, is the gap. And I think it's important we know that.
Yeah.
I guess, I know we're not making decisions today. I think we've already made a couple big commitments. One, I believe, in my opinion, is to your effort, which I think is essential that you're doing. The other one is some of these counties in the metro area have been accused of being a little rudderless in how we approach the problem, and that's been, I think, in the media last week, some pretty strong accusations about county being a little bit reactionary and not visionary in how they approach the issue. And so that's why I still really support the Blue Ribbon Commission, is because I think it's going to help bring that much more framework and structure to how we get more bang for the buck moving forward in our vision and how we do it the Clackamas County way, as Chair Smith says, and we all agree with. And then the other thing that I think that we keep talking about, and I know I get really super excited and I get all those ooey gooey tingly feelings when we talk about it, and you guys have all heard me talk about this, is making sure that we braid resources together for a recovery center that has a residential component, or a recovery campus, which is visionary and huge, and we don't see a lot of that anywhere up and down the West Coast. But I think that makes a big splash and a big piece of the care continuum. So this isn't a ton of money, but we're going to need as much as we can braid in and make it work too for that. So just, Chair Smith, you're right. We don't necessarily have to spend this all right away. What do those time limits look like? What do the reporting look like? We do have essential commitments to, like, I believe, your program, and then we got to set the framework through the commission. That's kind of where, as I review this, I think that falls within the use of opioid money. That's just my initial reaction, and I do want to make sure that those touch points, when they leave the 23-hour stabilization, that you have those resources to do that work.
Thank you.
Thank you, Commissioner West. I would agree. So, Commissioners, just bear with me for a moment. Based on this very wonderful presentation you gave to me, I look at 3 areas. Now, this is just me, okay? I look at treatment, prevention, and criminal justice, okay? I think we all can agree we would like those, okay? Because they all touch a different area. And in a previous sheet that came out, each one of those treatments, preventions, and criminal justice requires an FTE. So we bring on an FTE and we spend our money in 2 years, and then we cannot backfill that FTE. What happens to that FTE? Does it go away? Because we don't have any more opioid money. It may be the best dang program in the world, but if we don't have money to backfill that FTE performing the wonderful criminal justice programs, because people have been given umpteen time chances, and you're going to pay the piper on this, or we can't continue with getting people into schools to educate children you don't take pills, or we can't get people into treatment centers that require, all this requires an FTE. I want an answer on, if we create these programs, what happens when the opioid monies are gone and those FTEs are hanging? Do we fire them? Gary?
Yes.
Okay, so let's just say we focus on treatment, prevention, and criminal justice. Commissioners, we all have what we want. Those are very important. I would bet the cities would say the same thing: prevention, treatment, and criminal justice. And those cities who want to partner with us know they can't afford an FTE either. So I want to know how we figure out that problem. You don't have to answer me today, but that's very important. Okay. Commissioner Savas, you're up.
Yeah, appreciate the dialogue here. I'm mindful that we have, for a period of time, unless the voters renew it, supportive housing services that can only be spent in the urban area. And we have, we'll see a gap, but not an equivalent amount of funding for the rural areas. These dollars seem to be focused on, opioid or the drug addiction problem, which, that can be for people that are housed, that could be for people that are unhoused. And certainly a lot of emphasis right now on the unhoused people that have the drug addiction problems, or it led to them being unhoused. So to your point, Chair, about the FTE, I'm just really wondering if there's opportunities. These people are, better at this and more wiser and more experienced at this than we are. If there's opportunities where, if these dollars are used for something that has got a lasting impact, but the funding is weaved or braided funding, where supportive housing services might be able to pay for the FTE, and then these dollars can be used for something like a detox center or whatnot. But I think it'd be really great. We know where our gaps are. right? And I think we ought to be talking about gaps too. And you got some of that in the packet with regards to gaps. But knowing that over an 18-year period for this funding, I'm just wondering what's the best way we can leverage it with some focus of some sort. The nexus between drug abuse and mental health, bad mental health or behavioral health issues. Following that, or either one can lead to the other. I just hope maybe our staff can come back with something maybe that includes some of that braided funding and opportunities and gap filling. Not here to prescribe it.
Yeah, you're really on to something that, and I'm going to take us back to the potential collaborative. That's why you use existing programs when you do this. You don't start something totally new. You look at what we have, and we can attach the opioid piece to it. And so we've braided, we're calling it braiding funds. We've been doing creative financing for years on everything we do in A3S. So this is multiple grants, typically multiple funding sources. And so you see same FTE over time, but the funding, the funding has changed over that same period of time. So what I'm saying is, if we look at whatever the board comes up with, if you look at the partners that are doing the work today, and we're augmenting or adding to that, you have the foundation, you have the core foundation already, as opposed to trying to start something totally new. So I would be concerned too if we started something totally new, and you're right, 3 years, 4 years in, we're out of funds, and then what? So we would be asking the same question. So typically that's how we do it. We could do some more work on that and research on that, but that's kind of how we're looking at it.
So you're saying there is a future for these potential FTE? There is a potential future for them?
Potential future, yes.
Okay, all right. Commissioner Schrader?
Yeah, that's to this point. That's one of the reasons I keep bringing all this information, because again, NACO has a blueprint for securing ongoing funding, okay, for these issues. And federal funding, DOJ, some HSA opportunities, Medicaid funding. You can use state funding, legislative appropriations. You can use local funding. That would be a tax levy, which probably we will not go there with, but partnerships with local hospitals and server provider collaborations. So there's a lot of different funding streams from the federal government, and then with the emphasis on the state government. So I think, to your point, Rod, that's what you just described. And there are case studies of other counties of how they've leveraged those fundings after they've used one-time money in order to get a program and a center established. So it can be done. Again, there's blueprints out there, and other counties are doing it. And one of the things that they made a big deal about is, okay, one-time money, so how do you continue to secure funding? So we're not going into this blind, and we have great staff that, I mean, you already know all of this, Rod, you just told us, but, we can go after that extra funding to keep it going, so. Right.
Yeah, and I just don't want to leave a really good program high and dry.
Yeah.
And there's expectations out there that all of this opioid money is coming in. Look, people, it's $2.9 million. That can go like that. So I just want to be cautious in our approach. Go back to the resolution that this board, thank you, Commissioner West, that this board approved of, and you will see prevention, treatment, and criminal justice in that, because we can't do everything at the same time. So I would encourage my commissioners to figure out what we want to do going forward, how we want to spend these monies. I'm very appreciative of the partnership. I'm very appreciative of the community outreach that you did, and knowing that there are people out there are thinking just like we are. I think, man, we got to do something. We've got to do something. Yeah, so that's good. Any other comments from commissioners? Commissioner Scholl.
I have a question. So, thank you for this information today. What is the next step? Somebody?
Well, we've heard you today, and really it's with the board, I believe, Gary, that it sounds like we're going to go to some of this issue is going to go to the Blue Ribbon Committee and be taken up there, is what I'm hearing today. And so we would be waiting to hear what comes out of that process so that we could move forward. There is work that we're doing now. And so at some point, if I'm going to be totally transparent, I'd be saying, whatever we come up with, there may be an ask coming that we are able to fund the coordinated efforts that we're doing today. And so that's just a small piece of the total, but I just want to be transparent about staff are working on this today, and we want to
I
continue that
am
coordination.
open to that, by the way, and I hope the
Appreciate
rest of the
that.
board is. If you've
Okay.
got something that's coming down the road, so to speak, and you need to go now, I'm not opposed to that. Just come back to the board and make a presentation. Commissioner Scholl, are you
Yeah,
finished?
good. No, that answered my question. Thank you.
Gary?
So the next steps are the board just identified 4 things they want you to focus funding on, and a 5th you did not mention today, but you've talked about publicly before. That's a navigation center in Oregon City. What opioid dollars could we potentially use for this project? So my advice is, you've heard what the board has talked about today, the 4 areas, which are a blue ribbon panel, recovery model, recovery center, stabilization center. Put that in the mix. That's more than to spend the money we already have in hand, so clearly we have to staff, prioritize, come back to the board. No penny will be spent without your approval, commissioners.
That's
So
fine.
that's the next step.
Commissioner Savas?
Yeah, well, I'm going to come back and, like, thinking to weave policy and weave priorities and weave funding into something, and I'd like to be able to see us close a gap. However you best think we can do that, and, and I know there's dollars out there, unique dollars that could be spent, but there's a way of weaving this together that the unique constraints of these dollars are maximized with all those other dollars, so, thank you.
Thank you. Any other commissions or, yes,
I
Ron?
was just going to say thank you. This has been a great discussion, and we appreciate it.
Well, thank you for all your work, everybody who's in attendance. Yes, thank you.
Thank you.
Gary, what's up next?
Okay, great, thank you. Next policy session, Bull Run Bridge update. Staff from Transportation and Development will present, Dan Johnson and Mike Besner. You heard a lot about this last week at your business meeting from the community. And here's the discussion as we promised.
Good morning, Chair Smith, Commissioners. Harken back to 1926, when there must have been some ribbon cutting on this particular bridge. Couldn't tell you. None of us could tell you because it was 90-some years ago. A bridge that we inherited from the prior Burnside Bridge, which was constructed in 1894. That essentially is a quick summary of the history and great service the Bull Run Bridge has given us. Essentially, the Bull Run Bridge carries Bull Run Road over the Bull Run River and provides access to communities and services above and beyond and along that roadway. I am joined by Mike Besner, Assistant Director of Transportation for DTD, to kind of do a couple things. One, run through current conditions of the bridge, provide some history on our efforts to date to get the bridge replaced, and discuss some ideas and concepts we have and get some guidance from the board around those ideas. So with that, I'm going to hand it over to Mike to go into a deeper dive.
All right, thanks. So as Dan mentioned, this bridge has been there for a little while. We've gotten great use out of it, and its sister structure, by the way, which we'll talk about, which is the Dodge Park Bridge, which is same bridge, just,
Oh, my God.
yeah. But the Bull Run Bridge in particular has, what's
They're
that?
both chunks of Burnside Bridge?
Yes.
That just got, oh, wow, okay.
Yeah, yeah.
Sorry.
The Burnside Bridge before the current Burnside Bridge was constructed, the one they're wanting to replace.
Recycle, reuse, there we
Be
go.
clear on that, yeah. It's deteriorated significantly over the last 25 years, as a very old steel truss will tend to do. This past January, as you're aware, ODOT did a new load rating per federal guidelines, and to keep everybody safe, and the calculation showed we had to lower it to a 12-ton load posting, and we were given a few days to do it, and we did so. So it's posted for 12 tons. I just want you all to know that since then, we've been working with our bridge consultant to say, hey, what tweaks can we do? And we think we have a plan where if we put some delineators up on it, make sure everyone uses the exact center, make sure they can't sneak 2 vehicles by at the same time, we think we can submit something that'll get it back up to about 20 tons, but we're still working on that. But it's a short-term deal. So we're actively working on that. But regardless, right now, small ambulances, smaller fire trucks can use it. We have actually worked with Sandy Fire very directly. We've analyzed some of their specific vehicles, and we've worked out some things where they can get, at least for wildfires, most of what they would need to over the bridge in an emergency. House fires would be different because the ladder trucks are just too heavy.
Ladder trucks are too heavy,
Too heavy, yeah, ladder trucks.
even if we increased it to 20 tons.
I believe they're heavier than that,
Okay.
but we're working with them. The heavier loads, the detour route has to go through Multnomah County. It's about 30 miles through Multnomah County, and there's 2 bridges in Multnomah County that are also posted, although quite a bit higher, and only for special trucks. So standard trucks wouldn't be affected by that posting. Loads that currently can't use the bridge include quite a few of those from the Portland Water Bureau when they do their work up in the Bull Run watershed, logging trucks that are logging both public and private lands, full-size county-operated snow plows and sanders can't either, they're too heavy, as well as garbage trucks. People are obviously getting their garbage attended to, but it's basically less efficient, smaller vehicles have to do it. Same with our snow operations, for that matter. Oh, the way it's deteriorating, it's not going out on a limb to say that in the 5-10 years, it's possible we'll have to close it due to just it not being safe for travel, which for under 12 tons, it is safe for travel. I just want to stress that. We would never have a bridge open that wasn't. We've been doing outreach for years with the CPO and with the companies. Our motor carrier folks have very good working relationships with a lot of the logging companies that operate out there, and we've been working very closely with them, doing outreach, making sure they understand the restriction. As far as we have been able to determine, compliance has been very good. We actually had folks out there yesterday, our motor carrier, just to make sure, and it went really well. As staff, what have we been doing? We have invested some funds on this bridge in design, so we've done about $200,000 to get a 30% design, which is what we call a type, size, and location for it. So we have a pretty good idea of what the new bridge would look like, where it would go right next to it, and how much it costs. And that alone will shave off probably almost a year off a timeline, by the way, if the bridge were to be fully funded. So we've been working on it. The current cost estimate is we need about $14 million. And that's with all contingencies and inflation and design and everything. As you are aware, we have submitted several grant applications to the Federal Highway Administration. The programs changed through the years, but we've applied for almost every single one of them. And we have not gotten any. There's been 7 of them between 2018 and 2022. We also submitted for funding to the Local Agency Bridge Selection Committee, which is statewide under ODOT's purview. It's federal funding for local agency bridges by formula in the state of Oregon. And historically, this is a very old funding source. Our county has done real well replacing bridges with this funding source throughout the years. We've done many with it. That committee is ODOT, 3 representatives from cities and 3 from counties, and it's all technical scores. It's technical across the board. Bull Run, and the technical score is based on a lot of factors like the structure, how much traffic, what's the detour length, is there a safety record, a whole bunch of, there's a lot that goes into it. Goes into an equation, spits out a score. Bull Run was 6th out of, in this last go-around last year, it was 6th out of 37 bridges that were submitted statewide by local agencies. Unfortunately, there's only 16 million available for the whole state. Didn't make the cut. But we were really lucky in this go-around. It's not all bad news. So we got Holly Lane over Abernathy Creek funded to replace, which is another old trust, not as old, but old trust. And we got design funding, $2 million, for the Dodge Park Bridge, which again is the same bridge as Bull Run, just a little bit over, and it's over the Sandy River, Lusted Road over the Sandy River. So since this last go-round, Bull Run's technical rating score has changed. The posting has changed it considerably, and it'd be a lot higher if this call for projects came out today. Historically, the Local Agency Bridge Selection Committee has not allowed local agencies to opine. So we can't say, hey, we prefer this one over that. They go with score. It's a good process for statewide, keeps it fair. There's not a lot of politicking going on. And it's been pretty successful. Having said that, given this, we did reach out to the committee through ODOT and said, hey, if Clackamas County were to come to you and say, given the change in Bull Run Bridge status, hey, can we move this $2 million that you just allocated towards Dodge Park to Bull Run? Is that something the committee would entertain? They came back to us and said yes, they would, which is unusual. Not only that, because we've already done some of the investment on Bull Run, we could take the same amount of money and also fund the right-of-way acquisition for Bull Run. So it would go from design funding for Dodge Park, which we haven't done anything on, we'd be starting at square one, to finishing the design on Bull Run and acquiring the right-of-way needed for the new bridge. If we formally request it, they would approve that. So let's talk about the two bridges. They're both great replacement candidates. I mean, they are. They are a little different. Bull Run carries more traffic. It carries a lot more truck traffic. Lusted Road, which leads to Dodge Park, is very windy, and it's actually length restricted. And so it does not have nearly the truck traffic that Bull Run has. The detour length to Sandy is significantly longer with Bull Run. Dodge Park, from both ends of the bridge, it's roughly 7 miles. It's roughly the same. So if you're going from one end of Dodge Park Bridge to the other, yeah, it's about a 14-mile round trip. But the detour to Sandy, it's not really affected. Bull Run's in poorer condition. We looked at our maintenance records. We've spent about $220,000 on just maintenance for Bull Run over the past 5 years, only $20,000 for Dodge Park. So we have another project on Bull Run. We got to go out. The deck needs some repairs again. So we're going to be out there again in a couple of weeks doing more patching. And because of what I mentioned, Dodge Park is actually a local delivery only route because of the curves on Lusted Road. So they're both great. There are reasons why Bull Run would be a better candidate for us. I know when we submitted the Holly Lane project, Dodge Park, and Bull Run to this committee for funding because we know they're just going to use the best score. It's not like we're competing against ourselves. We actually did at the time say, hey, if you had to fund anything, or between Dodge Park and Bull Run, we had at the time said Bull Run would be our preference, but it was too far down the list for that to matter. Either way, the cost of either of these bridges is a significant portion of the money available statewide. As I mentioned, it's like 16 million is all there is, and this would eat up almost all of it. Whichever one they do fund the design of, the committee's been pretty good as wanting to follow through on their investment. There's a decent chance in the next STIP, so this is 24-27 STIP we're talking about. STIP, I have it written down, Statewide Transportation Improvement Program, how ODOT programs the federal money throughout Oregon. Right now, the design of Dodge Park is on the 24-27 draft STIP. The next one would be 27-30, which could be as soon as 27. And if either project was designed by then, which either would be, because we'd make sure it happened, it would be ready in the beginning of that STIP process to receive construction funds. But the committee would likely use the money they have available to fund construction. It also gives us an opportunity to keep going after other federal grants, which would be great so that other communities in Oregon can use that money. I mean, it's all a win for Oregon, no matter where this funding comes from. That's a lot of information.
Thank you, Mike.
Yeah.
We'll stop right there.
All
We
right.
need to ask questions. Thank you for the concise presentation. So you say you want to move the $2 million from Dodge Park Bridge over to Bull Run. Does that put us in a better position to apply for grants?
For Bull Run, 100%.
Okay, so we're not going to be able to get a grant to build the whole thing, is what you're saying, correct?
Not from the statewide committee.
Not statewide. We
Yet,
continue
yeah.
the efforts at the federal level.
Yep.
Also, what about local match from not only Clackamas County, but Multnomah County and Portland Water Bureau?
Yep.
What's the status of that?
We've actually been talking to them, the Portland Water Bureau.
And?
We've had good discussions. They So I'll just tell you what's been said. They want to help. They said if we go back to to DC, the federal to DC application process again, they will be more involved. They'll be help. We've talked about them contributing. It's a definite possibility.
So last year, I took a letter signed by the Portland Water Bureau, Deborah Kafori, and myself to the 2 United States senators. And in that letter, we said bridge closure would be imminent. Okay, here we are. How more critical can we be? Now they're on, and the commissioner of the Portland Water Bureau signed it. Now they're saying, oh, you guys really were serious about this, weren't you? Oh, so do we need to do that again?
We will.
Okay, so whoever goes back to DC in the fall, we need to do that yet again. Okay,
One second, to get to that great question that you asked, there are phases to this discussion. We have the 30% design complete. By reallocating these dollars at the state level, we'll get 100% design complete. Possibly additional money for right-of-way. All those things bring the price tag down, provide a clearer understanding and documentation for a shovel-ready project. So all those steps position the project to be better for either federal, state,
Okay.
local match.
so do we have any of our own match here at the county in road funds or gas tax or anything else to do this?
Yeah.
How much?
Well, we would have to be, it's 10 point something percent. So,
10% of 14 million?
yeah,
Is
that would be the match for the
1.4
grant.
million?
Yep.
Okay, so we have 1.4 million and then possibly 2 million additional.
Well, the 2 million, we'd have a 10% match on, so 200,000. Whatever money we get in the grants, we're going to have a match, and so.
I'm talking about moving the 2 million from Dodge Park over to Bull Run.
Right, that would do the design. That's federal money.
Do you understand my math, Dan?
Yeah, so basically, to do that would be a local match of approximately $200,000.
Okay, all righty.
And there would be another match if we get other federal money. We can talk about that later, though.
But is it safe to say we would have 3.4 million to go toward the bridge? Is that?
No, we don't. We would need, if it's 14.2, let's say, which is the 200,000 plus the 16. If it's the 2 million and we have the 10% match. When we apply for these, we make sure we create a project prospectus which outlines it.
Okay,
Yeah.
so you're going to have to do a math sheet for us if we're going to make an ask.
Yes.
Yeah.
And there is funding to do so.
Yeah, okay, Commissioner Scholl?
I go across both the Dodge Park Bridge and the Bull Run Bridge quite often. The Dodge Park Bridge is about 3,000 feet downriver from my land. I don't get out, pull out my slide rule, and assess the engineering on the bridge, but I can tell you, the Dodge Park Bridge, the deck is very, very nice. I think it was refurbished a number of years ago. It looks very good. It's wide. There's no complaints about the Dodge Park Bridge. The Bull Run Bridge is the bridge where you approach it and you stop and you look and you take a deep breath and then you go across it.
Prayer, small.
Okay? So visually anyway, the two bridges are very, very different. And so I do support your option A to shift the money from the Dodge Park to the Bull Run, and look forward to your creative thinking on ways to get it funded soon. We've heard a 5-year window of opportunity before you put the closed do not cross sign up, so.
Yeah, and I did forget to mention in 1998, we did a major rehab to the Dodge Park Bridge.
And it looks really, I recall that, it looks really nice. The paint looks good. No one would accuse you of having a 120-year-old bridge there at the Dodge Park. Okay, so, anyway, thank you very much.
Commissioner Savas?
Yeah, sure, I'm prepared to make a motion.
Yes.
Okay, I move we approve staff's recommendation for option A.
I'll second.
Reallocate the $2 million to get this bridge going.
Commissioner Savas has moved that we request ODOT and the LAPS reallocate to $2 million in previously awarded design funding from the Dodge Park Bridge to the Bull Run Bridge.
And I'll second.
Commissioner West has seconded that. Further discussion, I just want to say for point of reference, 20 tons is 40,000 pounds, correct?
Yes.
Well, a log truck starts out loaded at 80,000 pounds. It can go all the way up to 110,000 pounds. So we still won't be there, and that is an economic stressor for whatever timber harvesting occurs up there, not only for the private people as they came to us. Also, is there anything else that we can do in the meantime to mitigate more wear and tear? Limit it just to one lane. Are we doing that now?
Yeah.
Okay, is there any other little quick repairs we can do?
That's what we're doing. That's why the plan we have, we think we can get up to 20 tons. We'll keep looking, but at some point, we can only do so much.
So we're talking full replacement?
Yes.
So the money that we're spending on this is going to go away? Yeah, so that's what's sad, but we're going to have to do something.
The improvement I'm talking about is very inexpensive.
All right.
And it's also, conditioning, as Mike said, they actually did a sting operation up there to really assess,
We don't like to call it that, but yeah.
Pardon me. Terminology is important, apparently. We went and checked it out. There you go. Just to see, who was following the rules, who wasn't. I mean, it's driving tendencies, too. It's how you cross the bridge, Mike's informed me a lot. If you don't know this, Mike's kind of a bridge geek. So, it's like, how do they approach the bridge? Because in my mind, I'd be like, I'm going to start and fly across that bridge as quickly as I can, which totally is opposite of what you want to do. I mean, you want to stop, drive slowly across the bridge, et cetera. So these are short-term steps that will help, but they are not going to solve the long-term problem. So the need for the funding is there. So.
Great. Okay, thank you for that. Commissioner West?
One of my questions is actually along those lines of yours, Chair, but it doesn't sound like we're to this point, but has it ever happened where we just restrict the usage to emergency vehicles or to specific types of higher priority vehicles and we just take down the usage?
I think we're kind of there. Cars don't do anything.
Cars don't do anything, okay.
They're very light. There's no wear and tear on that bridge from cars.
Okay.
And so it's the heaviest trucks have already been, basically can't use it. And we've been working with emergency services for very specific trucks to try and accommodate them, so.
And then I have a dumb question because I'm learning about transportation from the Dan and Mike University of Transportation at Clackamas County. Dan, thank you for spending some extra time with me on this, a day or two ago? Mm-hmm. In my office, I appreciate it. Can you guys explain to me what that, an accusation, I'm sorry, a right-of-way, what that right-of-way is that you're talking about, that we're acquiring some type of right-of-way, or can you explain that? I don't quite understand or visualize what you're talking about.
Yeah. So, yes, when we do transportation projects, our county roads are in easements, and they're called right-of-way easements. And when we do projects and we have to go outside of that, we have to acquire a bigger easement or a new easement or whatever it would be.
Like purchase additional land?
Mm-hmm.
Okay.
Yeah, but we buy an easement. I mean, it's like buying land, but it's buying an easement. And there's a whole process, state law, federal law that governs it. We have to come up with the project. We come before all of you and say, hey, this is needed, and we show you a map of what's needed. And then we work with property owners. We have to do an appraisal. We have to have that appraisal checked. We make an offer. They get 40 days to consider it. We negotiate way further than that. It's a very back and forth process that takes quite a bit of time. It's not what people might envision. It's not the big bad county telling them they had to vacate or anything like that.
So if you recall yesterday, I brought forward a right of necessity, and I said this starts good faith negotiations. Mm-hmm. That's essentially, so we do the design dictates where we need public right-of-way, additional public right-of-way. We come forward with that right of necessity to the board, you bless it, then that allows our right-of-way folks to go out and start good faith negotiations. And as I said yesterday, we don't condemn. It doesn't authorize us to go condemn. We would come back to you and have a discussion if and when that ever is a set of circumstances where we couldn't negotiate it out. But that's kind of that start of that process. I want to make sure we're clear, though. You keep talking about land. An easement is just a right over the land. We don't own the underlying fee. We just have an easement that goes over it for the public's benefit. So it allows the public to travel across that area.
Okay.
Yep.
And the reason why I added, why I think it's important, it's so we can use the federal money to buy the right-of-way, but it isn't all that much up there, but it's really time. It's a time-consuming process, and by getting it approved now
Okay.
and programmed, it can shave a year off the timeline.
Oh, wow, okay. Thank you for explaining that. That's all I got.
Oh, great. Hearing no further questions,
Do we have a
Tony?
motion?
Let's call the poll.
Commissioner Schrader,
Aye.
Commissioner Schull,
Aye.
Commissioner West,
Aye.
Commissioner Savas,
Aye.
Chair Smith.
Aye, motion passes 5-1. Thank you, staff, very much for coming
Thank you.
forward. Yeehaw. Okay. Gary, what's next?
Next session, ZDO 287, Zoning and Development Ordinance Amendments for Religious Land Use and Institutionalized Persons Act Compliance, Places of Worship. Transportation and Development and County Council will present. Jeff Munns from County Council, Martha Fritzie from Transportation and Development. Go ahead, please.
Good morning, Chair, Commissioners. We've discussed this briefly in executive session, but we are here today talking about how Clackamas County is currently in litigation concerning the process used by places of worship to develop their land. Claims have been brought against the county based upon RLUIPA, or Religious Land Use and Institutionalized Persons Act. These proposed changes in the ZDO will address these issues that were raised in this current litigation and reduce the county's liability in this type of case in the future. The legal issues, as I said, were discussed in executive session, so we're not really discussing that today, but talking more about the policy, the proper methods and the policy involved in how to address these issues with revisions to the ZDO. With that,
Martha, welcome.
And so I'm just going to, good morning, I'm Martha Fritzie with the county's Planning and Zoning Department, Division Group. And so I'm just going to very briefly go over how we look at the places of worship in our zoning code, and I'm going to ask you for direction on sort of which way to go to make changes to make sure that we are compliant with all of the RLUIPA regulations, the federal regulations. And so, as Jeff mentioned, County Council has recommended that we do review and amend our zoning code. Places of worship are allowed in most, but not all of our zoning districts right now. And they need to be treated similar to other assembly uses that are determined similar to churches. And through the litigation that he'd been talking about, it's become apparent that we maybe need to take a look at a broader list of uses than we had historically looked at as potentially similar to churches. And so in looking at that broader list, it's become apparent that we probably should make some changes to our zoning code. And when I talk about allowing various uses and allowing churches, you have to understand that under our zoning code, there's different types of allowance for uses. And I'm going to talk mostly about a primary use and a conditional use. And so the difference between the two is that a primary use is just sort of allowed outright. It's been determined that that use already is appropriate in this zoning district, but the use still may have to go through some development review to make sure that it meets the certain development standards like setbacks, if there's height requirements, parking, landscaping, other things like that. So just because the use is allowed doesn't mean it doesn't have to go through any other development review. A conditional use means that the use might be appropriate in that zoning district, but it does need to go through some additional review and a public hearing, and things like potential impacts on neighbors are looked at. That if it is approved under conditional use, it also still would have to go through the same type of development review for the actual development itself. So in most of our zoning districts, all of our residential districts, and most of our commercial districts, places of worship are only allowed through a conditional use permit, whereas some of the other uses in this sort of broader list that we had looked at might be allowed as a primary use, and so that potentially would be a conflict. That's something that we would need to resolve. In some of our other zoning districts, particularly the industrial districts and open space management, places of worship are currently not allowed, whereas some of these other uses that we've identified that may be similar are allowed either as a primary or conditional use. And so that needs to be remedied as well. So when all is said and done, nearly every single one of our zoning districts needs some sort of change. And so we are coming to you today to ask you to get some general policy direction from you about what type of change do you want to make. And on page, I need to put my glasses on, page 3 of your policy session worksheet, we tried to just sort of simply state the question, and really, do we want to go the direction of making the way a place of worship is approved, make it more permissive, make them primary uses in most of our zoning districts? Or do we want to take a look at some of these other uses that might be a primary use and make them a conditional use, or be more restrictive on those other uses? Go one way or the other. We just need to know which way to go with our code amendments that we will then draft and send out for public notice and bring before the Planning Commission and you for public hearing. I guess there are some considerations for going each direction. If we're going to be more permissive with places of worship, we essentially will be allowing them in every single zoning district in the county. In most of those zoning districts, they would be primary uses. Again, they would still have to go through development review. And in a few zoning districts, they would still be conditional uses. If we are going the other direction and making some of these other uses more restrictive, I mean, the most obvious implication is that we are making other uses more restrictive than they currently are now, and maybe even prohibiting some uses that are allowed right now. And there are certainly implications of that, potentially more controversial. And we would, under state law, we would be required to notify every single property owner of every single property that we are being more restrictive on under our zoning code, which certainly adds some time and expense. I guess there's 3 options listed in your policy session, and they're intended to direct staff. Do we become more permissive with the places of worship, less permissive with other, or maybe there's some combination where there's some zoning districts where you want to go one way and some where you want to go the other?
Thank you very much for that presentation. Is this particular change on religious institutions result of a lawsuit?
Yes, I mean.
Thank you. That's all you have to say.
That's all I'll say.
Okay. I do like what's being offered, making places of worship more permissive. I think that's very important. Churches and religious institutions provide a vital service that government is not able to do, and we have relied on them for many things. Food distribution, for one. Shelter is another one. Even there's a clinic in one of our churches. And so that's where government cannot do everything. This sector can, and I'm most appreciative of that. I think because our county continues to grow and demand increases, why would we ever restrict any of the uses? I would not support that. Are you kidding me? Who's going to go out and tell that person who's actively engaging in a legal use, oh, we're going to make that illegal? Nope, that's not going to happen, I don't think. I just think that is not, we are not a punitive government here at Clackamas County. We are trying to work with people to get them to where they need to be, prosperous and successful, but also keeping health, safety, and welfare at the primary center point of what we do, and I think that the staff realizes that. We have some commissioners in the queue. Mr. Savas, you're up.
Yeah, I'm kind of concerned about maybe it's always more complex than we recognize at face value here, but I'm kind of wondering on the other uses, for example, we have in our industrial area, the Clackamas River, right? So there's natural areas, so to speak, that are typically associated with that, but yet it's industrial zone. So if we put these on level playing fields, would churches, I'm just going to take an exaggeration here or an example to exaggerate or ask the question, would we be allowing churches and nature preserves and wildlife sanctuaries in industrial areas?
Well, there's a lot of different zones that kind of cover that question. So I think that we were looking at it more by the different zones. And so in an industrial zone right now, if I remember right, they're not listed, and so they're conditional. So if I made it permissive, then they would be in an industrial area. But again, if you're talking about like a natural area, there's a lot of restrictions on those as well, and like exclusive farm use, and so there's other more restrictive areas under state law. We have to address those as well. So I guess your question sort of combines how you put them all in one. I don't know that typically exists, but I think Martha could probably answer that.
Well, let me just clarify the question to give you a better, so can we today, because you have government-owned recreational uses, so I'm looking at the bullet here.
Yeah.
So one of those is nature preserves and wildlife. Can they be, are they a permitted use today in industrial zones? Today.
So I'm going to have to refer to my handy-dandy matrix. Yes, some recreational uses are allowed in our industrial zones. I'd have to actually look at which specific ones in our zoning code. Churches or places of worship are currently not allowed in any of our industrial zones. And so we would not be changing anything about the recreational uses that are currently allowed, but we would be adding places of worship in there.
Okay. I bring that up as one example because we don't have very much industrial land out there, period. There's a scarcity out there. And so not that I want to limit religious organizations from that, but at the same token is I want to preserve the industrial aspects of it, right? But I do see the rationale in giving them fair standing as other uses currently. I think that's what you're asking for, suggesting here as a result of the lawsuit. So I'm just kind of wondering what am I missing? What other consequences would we have as a result of this? Not from a fraternal or a religious organization per se, but is this elevating those other uses, whether they're government or recreational? Is this elevating them or just keeping them in the same level?
Keep them in the same place. And I think to get to your question about, like, you wanted to protect, say, if we had very limited industrial lands, that would be an example of saying, okay, in some of those circumstances, and you don't have to do it today, that could be a subsequent decision as well, and could be changed if we find that this has become an issue, that, all those other uses are already there, and we're just talking about changing it so that the places of worship are treated equally. Now, if you find that many of these other uses that are competing with the industrial uses are causing an issue, then you can create those change those to all as a conditional use and treat all of those types of institutional and assembly uses the same. And that's really the core of the RLUIPA statute, is that places of worship are treated the same. So but they are different than an industrial use. So that's where we wouldn't create additional liability for the county, but you have to treat the place of worship the same as other similar uses. And we're not saying that all of these things are definitely similar, but I think they are clearly different than an industrial use. And so you can create priorities that way by treating all those other things in an industrial zone the same as a place of worship.
Okay. My last question on this is, I'll make a statement, then ask the question. So I've heard well over 12 years now from property owners in areas where it's urban reserve or poised to be urban reserve, and they foresee development happening. And I hear the complaint about, the growth of churches and religious organizations taking place there, and that being an impediment towards developing, or the whole area will become this if we don't do something. So there's a different interest group, right? It's a different perspective. If that does take place, is there anything about a religious facility, a church, being somewhere that would impede any development nearby or an adjacent property?
Well, if the other development you're talking about would be single-family homes, if that's permissive in that zone, just the fact that another permissive use is already there isn't, and they're both going to continue to go through the design review process that Martha mentioned. They're just not going to go through a conditional use process. So many of these concerns are dealt with in the process that we will continue to have.
Okay, all right, that's all I have.
Thank you. Commissioner Schrader?
Yeah, I think I should know the answer to this question, but do church institutions pay property taxes? Do we know?
I don't remember. I don't think, not for the religious, they're not paying.
I don't think so.
Yeah, sorry, not my, they don't pay income tax, I know that, but, yeah.
It's property taxes.
I can
because-
get you a clear answer on that, but I don't
Well, that,
work on that. I don't
which
believe.
is fine. I mean, I'm assuming that they don't, but then we will be opening up potentially more development that is taking away from the tax base of the county is just my point if they don't, but I don't know the answer to that.
I don't, there's a head shake in the back that we are thinking that churches do not pay property taxes, is the general thinking. We
Right.
can get a better opinion for you
Yeah.
later.
But I
No,
would say
and-
that there's somewhat of a reflection of the population per capita, and so whether, they wouldn't pay the tax no matter what zone they're in, so this just means that they're treated equally in each zone, so.
Okay.
They wouldn't concentrate them so much, they may move into other areas.
Okay. Got it. So it wouldn't necessarily be an industrial zone where we'd be losing potential tax revenue from a business locating rather than a church.
Right.
Okay, thank you.
Commissioner Scholl?
Yes, good morning. On option one, if we adopted option one, would that result in a more efficient administration of permitting on the part of DTD, or would it make it more complex? And what would be the level of difficulty of dealing with the conditional use approvals in what you call a few zones? In other words, if we adopt option A, will that result in a problematic administration of the ZDO? And also, one last question, if we adopted option A, would that essentially eliminate the federal lawsuit pertaining to this?
Well, let me deal the lawsuit side to say it reduces our liability and assists us. I don't want to go into the specifics of the actual lawsuit in this. I think that's more appropriate conversation for executive session and how that specifically would work. But I think as far as, Martha can give you more detail, but if we eliminate the conditional use layer for places of worship, it does simplify the permitting process, as opposed to adding conditional uses to many other uses in these different zones.
Okay, good. That's what I wanted to know. Thank you.
Thank you. Commissioner West?
Thank you for being here today. Which of the three options makes us compliant to have less liability while also making sure that we don't have a cascade of events that cause us to have maybe livability issues within communities because certain things just may not be appropriate within certain places, as I think maybe Commissioner Savas was alluding to. You put big, giant development, sometimes churches in certain places. I mean, that's traffic. There's all kinds of things that's why we have zoning, right? Isn't to say, no, we don't want all the most amazing, awesome churches in Clackamas County because that's not the opinion of this board or of this government. But what option gives us the right balance to the goal that we're trying to set today? I don't know, and I don't want to put the county at additional risk with zoning in the future or with the lawsuit.
Well, I think there's two pieces, and I'll just briefly, the first, staff recommended option one for confronting the liability, but as far as the zoning goes, I think Martha can speak
Is there a
to that.
balance between we get option one and we get the zoning thing handled too?
So all three options would reduce our liability. Okay, all three options in terms of the lawsuit do the exact same thing. And so it comes down to really what the policy decision is about whether or not you want to be able to continue to prohibit this use in certain zones, for example. So option one would, I think, result in more efficiency in our zoning code. And it would, though, result in us allowing places of worship in every zoning district. I think that a lot of the livability issues that we would be concerned with are actually addressed through development review, because we do, in many cases, through design review, we require traffic studies. And so there are a lot of things that are looked at through the development review that could be tied to livability. With that said, there are areas in the county that are exempt from doing some of those things. And you know, so in every case, we wouldn't be able to look at every single issue. But it's hard to say when you talk about livability. I mean, that means so many different things to different people. Like any of these three options, I feel like could get us there.
I'm just concerned that I don't want a church in an industrial area necessarily because it's such valuable and essential land for us to have a vibrant economy, and we are really scrambling to try to get more of it. It's just not an appropriate use even. I don't know if it's often would be safe to have a bunch of people congregating in an industrial area, but so like if we allow it everywhere and it's kind of, I don't want it to be a free-for-all. I want good, just boundaries that work for a good, safe, livable community. I also don't want to be so restrictive that we're strangling out, you know, places of worship either. I just don't know I don't know that balance is today.
So I understand, and I think that's really more of what's listed under option 3. And I think that would be more, do one thing, maybe be more permissive in some zoning districts and keep it prohibited in the industrial zoning districts. But you do have to understand there are implications of that, and that would mean in our industrial districts, we would have to prohibit some other uses that are currently allowed.
Like what?
And that might be fine. Like, for example, in some of our urban industrial districts, we allow arenas, exhibition halls, and stadiums. Arguably, that might be considered similar to a place of worship. We would have to prohibit that. Or, and then certain recreational uses that may be similar in terms of places of assembly, we would have to prohibit those. And so that's sort of the dilemma that we're in right now.
And I think one thing to note about places of worship and these other recreational uses is that their hours of operation, when people are there, generally are somewhat opposite the business cycle of industrial or commercial uses. And so you'll see this kind of mixed use where it can be efficient use of, say, parking and other things in the same zone in other areas. So, yes, pluses and minuses. And clearly, these issues, as they come up, these issues in the ZDO can be addressed singly. But I think for the current case, and some, more permissive does address that, but if you wanted to be more specific as to each zone, that could be done.
I gotta say, I'm just kind of stumped. I don't know, just to be fair.
So, our LUBA, does that permit churches and agricultural land?
So those are two separate issues.
No, I'm just asking just
but-
for general reference.
Agricultural and forest lands the uses allowed are dictated through state law. We're not proposing to change anything. That would
I
have to
know.
change under state law.
Well,
Yes, it should be consistent with RLUIPA.
It does, I know that. I know churches are allowed in EFU, and I was hoping you would say yes. Okay, if I was going to build a church, I would pick the cheapest land out there, and farmland would certainly be much more affordable than anything in our industrial area, is my point on this. And I remember when our LUBA was passed, and it was the new thing that came in, maybe late 70s or 80s, I'm really dating myself. Oh, churches can be built on EFU ground, because I believe it was a Supreme Court case, but I could be corrected on that. So that is allowing more availability of churches not to be built in our very precious commercial and industrial land areas. It's probably a supply and demand issue, I would guess. Commissioner Savas.
Yeah, I just want to, there's a few things that concern me. I mean, it's really not part of the conversation, I'm going to guess, because it's something that we could take other steps in another setting to remedy, but it just doesn't seem like having an equestrian facility, for example, in an industrial area or even a housing area is a smart thing. It ought to be, if we're going to do smart with our land, we would put that on some rural properties as opposed to industrial or housing or urban areas, right? But the way I'm reading this, I asked a question similarly, so I'll just ask another one. are equestrian facilities an allowed use in an urban area? Probably, answer is probably yes.
No, I think that what.
Is that right?
No, I think that, some of those uses like that are more rural uses are in the rural zones. If we're
Okay.
talking about more residential zones, then no, those would not be allowed or be a conditional use. And so what these ZDO revisions really try to address is simply that places of worship are treated the same as other potentially similar uses. And so that's what would be the only change, is not allowing some of these other recreational type or other types of uses in zones where they're incompatible. Just allowing a place of worship to be treated the same as other potentially similar uses where they are already allowed. And that's all, elevating essentially or simplifying the process for a place of worship, not allowing all kinds of other things in every zone, just making a place of worship have the same treatment in all the zones where any potentially similar use already has, an easier path potentially than a place of worship.
Okay. Well, Chair, I'm at any time, I'm ready to support option 1 or staff's recommendation.
Thank you. Commissioner West is in the queue.
It's interesting topic, because the bar is so high to protect religious freedom in the First Amendment, and that, the government shall not infringe on any of that. So the bar, specifically with churches and places of worship, that's like in this fraternity, that's like a really high bar. What is standard in other counties like Clackamas County? What does Washington County, what does their zoning look like on this issue to make sure that they're, like, do we have other models like, hey, this has worked, this has found that balance, this protects religious freedom in places of worship and doesn't overly restrict them while making it, like, where is that, have we seen anywhere else find that balance that I'm asking about?
So we haven't looked at other jurisdictions at this point, and we may, but we also don't know if they've ever been involved in any lawsuits related to RLUIPA. We have read through lots of cases, and lots of jurisdictions have had problems, and so we're interpreting from some of these other cases what may or may not be considered similar to a place of to a place of worship that we would then have to match up in our zoning code.
Yeah, and that's from my work working on this case, as well as others, the RLUIPA case law lags the adoption of the law significantly. And as different, it takes time to develop a church and to build those facilities. So it's, the statute's been around for quite some time. It's passed in the early 90s, and litigation has slowly evolved. And now what we're seeing is that a lot of jurisdictions have zoning regulations like we do. And so they're being challenged, and there's different ways these cases come up. But in this particular one, it's very similar to what's happened all around the country. And so we want to address it this way, and it's the simplest method to do so.
Thank you. Are you done?
And there's other safeguards that within the land review process that go beyond zoning to make sure that it's still an appropriate fit within a community or area.
In terms of the development, not necessarily the use itself, but in terms of what the development looks like and how the land is developed.
Okay, thank you.
Commissioner Savas, your motion.
Yep, I move to approve the staff recommendation, option 1.
Second.
Commissioner Savas has moved to direct staff to draft amendments in the ZDO to be more permissive for places of worship to the extent necessary to align with existing allowances for other potentially similar assembly-type uses and proceed with public hearings. Commissioner Schrader has seconded the motion. Any further discussion? Seeing none, Tony, take the poll.
Commissioner Schull,
Aye.
Commissioner West,
Aye.
Commissioner Schrader,
Aye.
Commissioner Savas,
Aye.
Chair Smith.
Aye, motion passes 5-0. Thank you very much.
Thank you.
Gary, what's up next?
That's all for today, Chair.
Seeing no further business before this commission, we are adjourned.